Well, welcome to the Ask Dr. Wilson show. My name is Dr. Nick Wilson, fitness specialist, max living doctor, and your chiropractor. And every week I bring you natural health tips, inspiring stories to really help you unlock your best life. And we're going to get right into the topic today, which is the real pandemic. Real pandemic is our healthcare model. And let me explain what I mean by what that means to have a real pandemic being our healthcare model. Right now in America, we have a problem, COVID-19. I would say maybe the reaction to COVID-19 might be the bigger problem, but I'll get into that here during this show. And it seems to be that this virus, whether there's been some artificial manipulation of the statistics or not, whether there's been some inflating of the numbers either accidentally or purposefully or not, it seems to be affecting the United States at a higher rate than other countries. And so the question that we might have to ask ourselves is, why might that be? And yes, there is corruption. Yes, there is problems with the statistical analysis and also the reporting of the deaths. As an example, I said this on my show last week, I'll say it again. Just because you die with COVID doesn't mean you die from COVID. And yet there's been many instances in many states where someone who dies with COVID is reported dying from COVID. That's very different. So we know that the numbers might be inflated, but the challenge is that in America, we have some of the worst health outcomes, yet we spend the most. And so let me give you some statistics here. We spend twice as much on healthcare as we did in the 1980s. We currently rank dead last out of all industrialized countries when it comes to health. C-sections, we have the highest rates here in this country, the United States. We have the highest infant mortality here in the United States. And yet, here we are. We have the best of everything. We have seemingly the best doctors, the best hospitals, some of the best access to that model, and yet here we are ranking dead last. Did you know right now medicine is now the number one cause of bankruptcies? 62% of bankruptcies are due to medical debt. Do you know what the number two reason for bankruptcy is? Is that you can't pay your mortgage. But do you know the number one reason why you can't pay your mortgage? You guessed it, medical debt. And so even before COVID, medicine was really bankrupting our nation. I'll give you more statistics to back that up because I know it's bold. And listen, I have doctors in my family, nurses in my family. I understand the sensitivity here. Listen, I'm in healthcare, guys. I'm in healthcare. So this isn't a bash of the medical system or the people within the medical system, but I think we need to recognize that what we're doing is not working. We spend the most $10,000 per individual on healthcare per year. And you know who gets abused the most in the system is actually the elderly. Did you know 80% of healthcare spend is in the last 6 months of your life? And so we have to come to the conclusion at some point that maybe we need to take a step back and realize that it's not the virus as much as it is the system. It's not the virus as much as it is the system. Give you an example. Japan, they have 126 million people. They've seen 1,007 total COVID deaths up to this point right now, as of this recording. They have a 3.2% obesity rate. Compare that to America with 40% obesity rate. Yes, we have 328 million people, but we've seen 155,000 total COVID deaths up to this point. So consider this. What if we have chronic disease, chronic illness? We talked about co-morbidities a lot in the first part of the COVID-19 pandemic. We talked about the fact that if you have a comorbidity, you're more likely to be in an at-risk category. That conversation has faded quickly. Why? Because it very quickly became about the fact that if you're healthy, you're way less likely to have problems. But there's this attack on healthy people saying, no, the healthy people are putting the unhealthy people at risk. No, you have to become infected to infect somebody else. Let's be very clear about this. And so if you're less likely to become infected, well, then you're way less likely to pass on an infection. And we talked a lot about comorbidities. What were the comorbidities? We talked about obesity being a big one. And what is the major difference between Japan and the United States? 40% versus 3.2% obesity rate. Alarms should be going off in your head right now. Okay, so they have better health? Do they have better health care? Well, maybe, just maybe, they don't try to treat every symptom under the sun with a pharmaceutical agent while also allowing a population to continue making decisions that make them fat, sick, and nearly dead. I don't mean it to be harsh, but I think we need to take a step back and realize that we have created a breeding grounds for sickness. And does that mean we blame McDonald's on our healthcare costs and our faulty healthcare model? No. Listen, when it comes to chronic sickness, chronic disease, there's two very, I would say, diametrically opposing paradigms. There's one that is very big on treating symptoms. So let's give an example. You have a headache. What do most people take for a headache? They take whatever the over-the-counter drug is, or if it's bad enough, they have a prescription for headaches. Here's the critical question that you have to ask yourself. Is the cause of the headache a lack of that common over-the-counter medication or that prescription medication? How about acid reflux? Is the cause of your acid reflux the fact that you don't have Tums or Pepto in your bloodstream? Or how about cholesterol? Is the cause of your high cholesterol the fact that God forgot to put Lipitor, Zocor, Crestor, or Simvastatin in your blood system? It's not the cause of the problem, but what are we taught to do is treat our bodies entirely based off of symptom management. You get a symptom, you cover up the symptom, you feel better, and if we judge our health by how we feel, what do? We go on living as if it never existed in the first place. And listen, that might be okay for maybe you drank too much the night before and you got to figure out a way to go to work the next morning or something like that. But we're talking about chronic conditions right now. We're talking about chronic illness that is plaguing America. And why do we have such extreme high rates of chronic sickness, chronic disease, and susceptibility to infection? Let's call it COVID-19 or whatever. It's because we are so sick, but then there's a system that perpetuates the idea that you cover up your symptoms and continue living. A prescription is a permission slip to not change. A prescription is a permission slip to not change. And when you realize that we don't get curious about our bodies because we cover it up so quickly, and then what happens is that when a system starts to go south, let's call it your endocrine system, so hormones start to go south, or you start to develop what's called diabetes, what do we then do? Oh, you have high blood sugar? Here's metformin. Take a medication. That's going to help to lower your blood sugar. Or hey, you've got a pain and it gets worse and worse and the common medications are not touching it. Well, hey, let's get on an opioid medication. Now we have an opioid epidemic where 63,000 people every single year are dying because of prescription drugs, opioids to be the number one culprit. And you say, well, at least we have a good healthcare system. Well, that's debatable because yes, we have the best of medicine. We take the most medications. We are 5% of the world's population, yet we take 70 to 80% of the world's drugs conservatively. Best hospitals, best doctors. We fly in other doctors to practice medicine here. And if more access, better access to that system, more drugs, more surgeries, more doctors, bigger hospitals is the answer to us being healthy as Americans, we'd be the healthiest country on the planet. But when you rank us, we rank dead last. And when you actually look at the net outcome of what we're trying to establish here, the net outcome, according to Kilo, so this is a study done in 2009 from the Journal of the American Medical Association, quote, healthcare does more harm than good. It's not the only one. Starfield published a study in 2000, again in JAMA, that doctors are the third leading cause of death. And ironically, Starfield herself actually died from a medical error just 10 years later. She suffered a lethal injection or lethal reaction to an injection as an inappropriate antiplatelet drug. But whether you look at the JAMA studies, you look at the British Medical Journal, who showed that in 2016, medical errors now kill 250,000 people per year. Yet, where are we with the current COVID-19 count? Around 155,000. My question is, where was the pandemic when the British Medical Journal came out and said that, yes, medical errors kill 250,000 people per year? Currently 100,000 more than COVID-19. Where was the outrage at that point when that came out? I'll answer that question for you. There wasn't one. I remember when it came out thinking, wow, this is going to revolutionize healthcare since 2016. And what do we have now? Well, we have the same, if not worse, outcomes. And you wonder, why wasn't there outrage? Why wasn't this all over the news? Well, who owns the news? Who spends the most money in advertising, in marketing? Which companies and which industry spent $30 billion in advertising in 1 year alone? You guessed it, that was the pharmaceutical industry, which was double the closest entity or closest industry, which was gas and oil. So $30 billion in 1 year to direct to consumer advertising. Do you think the media will ever come out and go against its number one client? Of course not. What's really interesting is that this is not new news. Marcia Engel, she was the editor of the New England Journal of Medicine for 20 years, said, quote, and I'm quoting, "It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians, authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine." The reality is that our healthcare system has been bought, and we have a model of health that attempts to treat symptoms as opposed to get to the underlying cause. There is a really big problem with letting or allowing a person to continue a toxic and destructive lifestyle and then give a drug solution while they continue that toxic lifestyle. What we need a revolution in healthcare that will not happen at the hands of those who are trained in a drug surgery model approach to treatment of chronic illness. It just is not going to happen. I'll give you an example. I had a patient who came into my clinic, and this person was on 22 different medications. Literally had a doctor for just about every system in the body. Was obese, had diabetes, was on multiple medications for blood pressure, obviously on medications for blood sugar, had been diagnosed with a thyroid disorder, on a handful of psychological drugs, antidepressant, anti-anxiety. And I'm sitting down with this person and just wondering who is responsible for this person's health. And it dawned on me that it's the person sitting in front of me. That person is actually responsible for his health. And he didn't see or was never taught that he had to be his own advocate for his own health. Listen, you can't just walk into any doctor's office of any kind and say, "Hey, my health is in your hands. I take no responsibility for my health. It's in your hands." That's not how it works. You have to be your own advocate. You have to be well-versed. You have to know what you're doing, but you don't have to know all of medicine. You have to know the right essentials that your body needs in order to thrive. We call these the 5 essentials. And what that means is the 5 essentials. They're not just good ideas. They're essential to health. They're essential to wellness. They're essential to max living. And that's why we call this max living. So what are the 5 essentials? This is what the 5 essentials, and this is what revolutionizes healthcare if it would be implemented across the board. If doctors were trained to, just consider this, think if doctors were trained to analyze a person's nervous system to see how it was functioning, whether it was balanced or imbalanced. They looked at a person's diet, look at the nutrition, that they did specialty testing to find out where their nutrient deficiencies were, where their toxicities were coming from. They encouraged and taught and educated on exercise and provided resources for this person to exercise in a way that was genetically congruent. They taught and had seminars and workshops on mindset, and when you walked into their practices, that they had all kinds of materials and videos playing that would encourage strong growth mindset versus a fixed mindset. They encourage you to look at your body as something that was self-healing, self-replicating, and able to heal given the right circumstances. And just consider if that was the model of health that was taught in schools. That growing up from an early age, you were taught from a very early age exactly how to take care of your body. That symptom management is not health. That when it came to public health in school, you're not taught about you're not taught just proper face mask utilization and how to wash your hands. You were taught proper nutrition that encouraged food that was from the earth, that was sustainable for a lifetime, that minimized toxic exposures, that minimized what we would call interference within the body. Think if then grandparents who grew up in that system would pass down wisdom and influence and how to cook and how to meal prep and taught that to the next generation. Think of what our health system would then look like. And then we'd have the drug and surgery model in a crisis situation. It would be appropriately utilized in the right situations at the right time in a crisis. And not try to apply and not put all this pressure on our doctors and nurses to apply a crisis model to general chronic health conditions that were caused by an accumulation of toxins or a lifestyle-induced problem that was likely initiated decades ago. Just consider if that was healthcare. And now you see what we're trying to do in Max Living. And now you understand what we're up against, but also you understand that what we need right now, we don't need better access to a crisis model. We need a revolution in healthcare, and we need a paradigm shift. That's what's needed. That's what we're trying to do. But we do it in, like my clinic, we do it one patient at a time. And it starts with that one person at that one time who may be struggling with their health. And it may be you, that you're struggling with your health. You need some help. Listen, if you're struggling with your health and you know, hey, it's time for a different approach to health and healthcare, maybe it's time to join a new paradigm and make a little bit of a paradigm shift when it comes to the way you view and manage your health. And that's why we exist. We are talking about the real pandemic, which is our healthcare model. I made some bold statements about that being the case, that the real pandemic is how we take care of ourselves, which is a breeding grounds for disease, and our healthcare model, which is actually not helping when it comes to the management of chronic sickness. You talk about co-morbidities, and this is a big problem with people, is the fact that they have obesity or they have high blood pressure, diabetes, AFib. These are some of the big contributing factors of what makes someone more susceptible to any infection, but particularly COVID-19. And yet here we are, we treat the symptoms of the problem without getting to the underlying cause. In this case, we're talking about a lowered immune system, which creates a susceptibility to either acute or chronic infection. And why would you have a susceptibility? Well, that susceptibility comes with a sick body, those comorbidities. And I hear people say all the time, hey, well, I am in that high risk category. Well, my question is, what are you going to do about that? You're in a high risk category. Well, now what? Do we continue living life the way we have? Because you see right now, what's one of the hashtags that's trending is quarantine 15. So we quarantined everybody. They gained more weight, which what does that mean? It means they're more susceptible to chronic sickness, chronic illness. They're more susceptible to something like COVID-19. So we're talking about the real pandemic, which is our health care model. And if you're still not convinced, just think about opioids. Think about opioids. More than 191 million opioid prescriptions were dispensed to Americans in 1 year. There's more than 67,000 people died from drug overdoses in 2018 alone. And guess what the leading cause of injury related death is, and what the number one prescription was with that, with almost 70% of the drug overdoses involved, was opioids. What's an opioid? Well, you probably heard of them, but do you know their names? Many of them are the ONE words. So think of methadone or oxycodone or hydrocodone. And what are they there for? What are they used for? Well, many times it's the management of a certain type of pain. I know I'm overgeneralizing this. I'm doing this on purpose because it's most of the time for pain, the vast majority. Do you know what the number one reason that a person would be prescribed opioids is? What condition? Is lower back pain. So here's the question that you have to ask yourself. Is the cause of most people's lower back pain the fact that God forgot to put opioids in their blood system? It's not the cause. We know it's not the cause. It actually sounds ridiculous when you say that. But what do? What's the common standard of care when it comes to someone with, let's just say, lower back pain? Chronic lower back pain, we do muscle relaxers, pain injections, anti-inflammatories. When that doesn't work, we send them to maybe a physical therapist to stretch or strengthen. When that doesn't work, then we do the consultation with the surgeon. And when all else fails, what do? Hey, take the drug, stay on the drug, and if it seems to work, let's just continue that standard of care. Well, you have to ask yourself, is that what you want for yourself? It's not necessarily going to change. Healthcare is not going to change overnight. The practice of healthcare takes 20 years to catch up to the research, just so you know. So let's say they come out and say, hey, we've got this awesome new approach that should be for this person with lower back pain. Listen, that takes 20 years for that to be implemented across the board in medicine. And that's all I've got for you today. Listen, hey, remember to think, but let's not think like everyone else. The culture seems to be breaking down. Maybe it's time to join a new culture, the Max Living culture. We've got a great one here. So listen, find a doc who you can get behind, who you can trust. Go all in on your body's innate ability to heal. And that's how you live your best life. And that's all I've got for you today. Listen, hey, remember to think, but let's not think like everyone else. The culture seems to be breaking down. Maybe it's time to join a new culture, the Max Living culture. We've got a great one here. So listen, find a doc that's closest to you, trust that doc, and go all in when it comes to your body's ability to heal, because the ability to heal far out. So good. It's good up until find a doc who you can get behind, who you can trust. Go all in on your body's innate ability to heal, and that's how you live your best life.